Well, we now know that COPD, or chronic obstructive pulmonary disease, can affect all age ranges and is associated with chronic inflammation of the lungs, which I think is a very important component of how we can deal with this disease going forward. So I think we have to parse this out in a couple of ways. One is the relationship with chronological age. Your birth date, for instance. We know that COPD is highly prevalent in those over the age of 60 and less prevalent in those between the ages of 30 and 60. So there is an association with chronological age. The second is the whole notion that COPD is associated with cellular or tissue or biological aging. And we now know that all the tissue within a COPD patient is old. But most therapies work better in the younger patient population than in the older, as a general framework. Azithromycin is an antibiotic that we use on a daily basis, and it seems to prevent at least some of the exacerbations. And it seems to work pretty well in both the older COPD patients and younger patients. The downside is that we are giving antibiotics on a daily basis, and there are lots of caveats associated with that, including antimicrobial resistance. We now need to find out what triggers the accelerated aging process in COPD. What genes or molecules cause COPD patients at a tissue level or organ level to experience this accelerated aging, and then most importantly, find ways to intervene and reverse or prevent that process from happening. And we have already some very good notion of that. Absolutely. We know, generally speaking, things that cause accelerated aging. One is cigarette smoking and air pollution that causes tremendous amount of oxidant and inflammatory burden in the lungs and elsewhere, and that causes accelerated aging. Poor diet, poor nutrition, especially deficient of green vegetables and fruits, will also cause accelerated aging through oxidant processes. Lack of exercise and obesity and sedentary lifestyle also accelerates aging. So these are, I think, important concepts that can be implemented in the management strategy of COPD patients to prevent further acceleration of the aging process.